Good morning, good morning, good morning, good morning. Good morning. Thank God it's Friday. I say that every time.
Yeah, but
Thank
really,
God it's Friday.
but really, thank God.
Yes, absolutely. So welcome. When you know it's Friday and Friday's here, you know it's another edition of the CareSouth Carolina Community Live Podcast. And I am one of your hosts, Mark Calhoun. I'm Director of Social and Community Services for CareSouth Carolina, always with my partner in crime.
This is Daniel Myers. I'm the MATHD Program Director for Care South Carolina. Glad to be on today, and glad to have such a wonderful guest on today too, Mark.
Absolutely, absolutely. She's certainly been a friend to the show, and every time she comes, she brings us great information. And we felt it was time for another update and get some information out on the Delta variant. This starting to look a little scary out there, Daniel.
It is.
Starting to look a little scary.
Yeah, it's kind of giving me flashbacks of you know the last the beginning of 2020 and how things are ramping back up and um, everything is opening back up. So it's really scary because people are not paying attention. So I think that this could be an eye opener to a lot of people.
Absolutely, absolutely. So with that being said, we want to welcome Dr. Jan Kelly to the show. Dr. Kelly is no stranger to the show. She's the Assistant State Epidemiologist, but I'm going to step out of the way and let her introduce herself and tell us a little bit about herself and tell us, why we're here today. What do we need to know? What does the public need to know in our audience? Dr. Kelly.
Well, thank you so much for inviting me back. I actually was on vacation for a little bit in June. The number of I hadn't taken vacation in a year. Things have been crazy, right, with COVID, the pandemic. But our numbers were coming down in May. Numbers were coming down in June. The number of people vaccinated was going up. Felt safe enough to take a little vacation. So I was gone for almost 2 weeks. And when I came back, I was really stunned to see how much has happened in South Carolina and how much has happened elsewhere in the United States with this new Delta variant. And just to say a little bit about the Delta variant, the key thing about this variant, like the other ones, is that it's more transmissible. It spreads more easily, but it spreads even more easily than the other variants. And in the United States as a whole, the Delta variant, it now is more than 50% of new infections. And if you look at states where, they're having a huge outbreak right now, like in Missouri, in Missouri, they are really in trouble. They have hospitals that are overflowing. They are needing to transfer some patients out because their capacity, their ability to take care of very sick people has been overwhelmed. It's been a long time since we have seen that. We've never seen that in South Carolina, but I'm worried that we may be headed in that direction. In Missouri, 98% of these new infections are the Delta variant. So I don't want to just tell scare stories, but because things were looking good in South Carolina, number of cases going down, and in May and in June, it was very exciting to see that. But in the past week, we have had more than 1,000 cases than the previous week. And that's not just because of more testing. These are definitely new cases. We've had a number of people in hospitals and the number of people in the intensive care unit and on ventilators, the breathing machines, increase this past week. So we were worried that there might be an uptick after 4th of July weekend. But I think this is more than 4th of July. I think this is also the Delta variant.
And Dr. Kelly, I know we're talking about the Delta variant, but I also heard in the news that there's another variant called the Lambda variant that we don't know anything. I mean, don't know a whole lot about right now, but that's out there as well. So that's causing me concern as well.
No, you're right. And there are always going to be lots of variants. This virus, all viruses, they mutate frequently. So I'm not surprised that there's a Lambda variant as well. Right now, it's considered what they call a variant of interest, meaning we're not as worried about it, but we have to keep an eye on it and see what's going on with it. But the Delta variant, it's declared itself. It spreads more easily, and we're deeply concerned about that. There is good news. The good news is that the vaccines work even against the Delta variant. So there is something we can do about this. I feel like sometimes we talk about the Delta variant or, the number of cases going up, that people feel like, gosh, what can I, will this ever go away? What can I do about this? And I know it sounds like a broken record, but vaccine is how we get out of this. Vaccine is how we end this pandemic and how we get rid of the Delta variant. Vaccines do work even against that Delta variant.
Well, I heard this morning on the morning news that also was fueling this people not getting the vaccine. It's all the bad information, and we talked about that before. But the bad information has increased and and discouraging people from getting the vaccine. You can see and I hate to call it these places, but like on TikTok, on Facebook, where they have people walking up under metal detectors and their metal detectors are beeping, or people having coins stick to their skin because there's supposed to be some type of magnetic chemical inside the vaccine is causing. But people, if you use your brain, there is no, the quarters they're not magnetic. So,
I know.
Right. So quarters are not magnetic. So if they're sticking, it's probably because this person got sweaty skin, wet skin, or some type of chemical in their skin to hold it up there. But we're quick to pick up on the negative side of things, and we're missing the whole positive side, that if everybody do their part, get vaccinated, then we can get rid of the Delta variant, the Lambda variant, or whatever variant that come A through Z. We can get rid of. We can get on with our normal lives. So
you bring up a great point about misinformation. There's a lot of scary misinformation out there, and it takes on a life of its own. And I just have to encourage people to try and think through things. Be skeptical. It's a good idea to be skeptical and to think, now, wait a minute, does that make sense to me? Like you bringing up the point about people sticking coins on their arms when coins aren't even magnetic. It's like, stop and think, how can I test this for myself? And who can I talk to try and decide what I think is real and not real? Because there sure is a lot of misinformation out there. And, the other thing that I think about, I heard a quote the other day. A friend said, we're not all in the same boat with this pandemic. We're all in the same storm, but we're not all in the same boat.
That's right.
And, as I look at what's going on right now with COVID and in camps for kids, summer camps, we're seeing outbreaks in summer camps. This time last year, there were summer camps, but they were doing it safely. They were wearing masks. They were, there was no vaccine last summer, and yet they could have summer camps without outbreaks. They had the kids in masks. They kept them in, in small groups. They had more things outside than inside, kept them distant. They were doing all the right steps, and they could have a camp without an outbreak. Well, this summer, people are taking off their masks. They're, feeling more relaxed about things, but we are definitely seeing outbreaks in those summer camps. And what that makes me worried about is what's going to happen this fall when kids go back to school.
Yes.
No, masks are not mandatory. And schools, individual parents and kids can make decisions about wearing masks. But I fear that what we're seeing now with increased outbreaks in summer camps is foreshadowing. It's just kind of a sneak preview of what might happen when kids go back to school.
Yes.
But when I say we're not all in the same boat, what I mean is that, for some parents, if their kids are exposed at school and they have to quarantine, for some parents, it's a hassle, but it's not a serious problem. They can work out childcare, or maybe both parents aren't working outside the home, and maybe they've got access to internet or something where they can continue education for the kids. But not everybody has that.
No.
Right.
If you're quarantining and your kid's got to stay home for 2 weeks and you don't have childcare because you're working outside the home, or you don't have high-speed internet, I mean, that quarantine is going to be a serious problem for some families and for some kids. And the message I would really like to get out to them is that you can prevent all that by vaccinating your teenager. Now, I'd love to answer questions. People are concerned about, safety of vaccine. I feel like we have a lot of information about the vaccines now, and I can answer a lot of those questions. But I have real concern that people are not thinking through what's it going to mean when kids go back to school without vaccine. If they're vaccinated, they don't have to quarantine. They're vaccinated, even if the kid they're sitting next to in school had COVID, they're protected. They don't need to quarantine. They can stay in school.
That's right. You know, my son goes off to college this year.
Uh-huh.
And so we made sure that he was vaccinated, you know, because we don't know who he's going to room with. We don't know what the situation is going to be in college, but we wanted to make sure that he was protected. But there's a lot of parents that's really saying that, well, this can't happen to me. You know, it's the same thing we've been hearing for years about every single thing. It can't happen to me, you know, or if it do, then I feel like my diet is strong enough. I take enough herbs and vitamins and I can fight this thing off. But that's not been proven. You know, it's been proven that if you're not vaccinated, then you are just susceptible as anybody else. And that, you know, you can have the same illness and the same degree of illness that some people who had the most severe cases, where it was hospitalized and ventilated and everything else, you can have those same issues going on with you. And, you know, if anybody need to be vaccinated, then at CareSouth, correct me if I'm wrong, but we have all 3 vaccines here. Am I right?
We do. Yes, sir.
So you know, you got an assortment, you know, come to the buffet, come to the vaccine buffet and pick your choice, you know, whatever you want to have. All of them are effective. So, but we really want to encourage people to, if you got any questions out there today, that's burning in your mind, that's on your heart, that you really want to answer to, log on and start asking those questions now, while we have a professional, somebody who have an expert that can really answer these questions and give you what you really need today. So you won't have these questions the weekend. You can go ahead and make your appointment to come into CareSouth. You can walk into CareSouth today, and we can give you vaccines a day. Any CareSouth will give you vaccines a day. So get online and ask these questions, whatever it takes to get you vaccinated. That's why we got Dr. Kelly here, so she can dispel those myths and give you facts about the vaccine, facts about the variant, and facts about COVID-19 virus. So, yeah.
So Dr. Kelly, let me ask you, what do you say to those folks who says, well, I don't know what's in the vaccine. I don't, I'm a little skeptical because I don't know what's in it. What do you say? I know what I say to them, but
what do you say to them?
We don't know what's in half the food we eat. So, but we still eat it, right? We don't know what's in the lotion we put on our skins, but we still use it. And then even some of us that are on medicine, we don't know what's in those medications, but we still use them because we feel like they're going to benefit us, the insulins, the chemotherapy, the blood pressure medicines, unless we're chemists, we don't know what's in those.
Well, and we use them because we trust the system in the U.S. with the Food and Drug Administration. Before there was an FDA, before we had all these things in place, there was a lot of unsafe food and unsafe medications and medications that didn't even work, but were, being sold over the counter or with a prescription, but there was no safety oversight. Now there is safety oversight with the FDA. So I feel like I know what's in those vaccines because I can read the chemical formulas that are published by the FDA. So, I can help address that. And I feel like we've got a lot of information about vaccines and short-term and long-term effects. I've heard a lot of people say, I don't want to get vaccinated because I'm just worried about long-term side effects. Well, the vaccine studies go back more than a year. At this point, the initial studies started back in people back in March of 2020. So we've got more than a year's worth of safety information about vaccines. What we lack is information on COVID-19 disease and long-term effects. That's what's coming out more and more now about the number of people, even people, not just people who were really bad, sick and in the hospital, people who had mild symptoms, but then go on to develop this long COVID, more than a month, more than 6 months out, then they're still having symptoms of shortness of breath, tired all the time, brain fog where they can't concentrate. And again, not just like in older adults or people with medical problems. We're seeing that in teenagers as well. And that's a real concern for return to school if they're unable to concentrate on their work.
Yeah, and that's what's scary. You know, we're so concerned about what we don't know, but we need to be more concerned about what we do know. You know, we do know that COVID kills. We do know that it can cause severe illness. We do know that it can cause hospitalizations. We do know it can cause people to be put on ventilators. We do know that. But so far, the side effects that we've had from the vaccine has been minimal. You know, the number that's been given.
Over 330 million doses of vaccine have been given in the United States. And yes, we've all seen the newspaper headlines that you'll have, a couple of cases of people with a severe allergic reaction, a few cases of people having, really rare, unusual reactions with a blood clot, or really rare, unusual reactions with the myocarditis, the heart inflammation. Mm-hmm. What you have to do is put that in perspective and compare it to what's your risk with the disease itself. So, just let me stop and talk about that myocarditis, because I think that's one of the ones that has been really scary for people to read about. Yeah, inflammation of the heart, that sounds terrifying. As a physician, I know that myocarditis can occur from a lot of different causes. There are certain viruses that cause it. Diseases like lupus can cause it. Certain medications can cause it. I've seen myocarditis, and I know that it runs a full spectrum. Person can have very mild inflammation that, resolves by itself, goes away spontaneously. It's just a temporary thing. What I understand with the vaccines is that there have been a few cases of this myocarditis. I'm not going to lie, there have been some cases, but that those cases have been mild. They have been treatable with medications like ibuprofen. So we're not talking about special IV, serious medications. They're treatable with anti-inflammatories. It's an inflammation. It's treatable with anti-inflammatories. And then, it resolves completely. And I know it's hard to get your head around some of the huge, big numbers, 16 in a million cases. What does that mean? Let me give you a visual example I hope helps. Imagine like a football stadium, 100,000 people. And imagine that football stadium is 100,000 men and boys ages 12 through 29. They're the ones that are at highest risk for this myocarditis. Mm. So 100,000 men and boys in that 12 to 29 in this stadium, and they all get vaccinated. 4 to 5 of them will get this myocarditis out of that whole 100,000. So not to minimize that, that's a risk. But let's look at the other risk of not getting vaccinated. So same kind of thing, stadium, 100,000 people, all men and boys aged 12 through 29, none of them vaccinated. About 1,100 of them will get COVID-19 in the next 3 months. About 55 of them will end up in the hospital. About 18 of them will be in the intensive care unit, and 1 of them will die. Now, that's only 1 out of 100,000, but that 1 was completely preventable. That's right. And even over 1,000 people get COVID, but most of them do just fine. Yes, but the other ones don't do fine, and it's preventable. So, either way, it's like choose your risk. You can get vaccinated and you've got, a small risk of getting a temporary heart inflammation, or you can not get vaccinated and then you've got pretty substantial risk of getting the infection at some point, right? You get vaccinated, it's a one-time risk. But if you don't get vaccinated, your risk goes on and on and on every month that you are possibly exposed. So I think when people are weighing risks and benefits, you have to think not just about the vaccine, but what's your personal risk of getting the virus? Are you exposed at work? Are you going to be exposed when your kids go to school and come home and maybe bring that virus back home again? You have to think about your risk of getting COVID-19 disease, which by itself has a higher chance of causing heart inflammation than the vaccine does.
That's right. And so I got some other things that's been pressing with people as well. So we've been hearing a lot of talk about, having natural immunity because you got the COVID-19, because you have COVID-19. and you recovered. And so it's been said, in the last couple of weeks to a month that that's not enough. Just having it is not enough coverage or enough, building up antibodies to cover you through these variants. So the vaccine is still recommended. Also, the monoclonal infusions. Can you talk a little bit about all those things, about natural immunity and about your risk factor?
Sure. And I'm so glad you brought up monoclonal antibodies. We'll talk about those in a minute. Let's talk first about what do we know? If you had previous infection and your immune system responded, then you should be protected, right? Isn't that the whole idea? You get exposed to a disease, you get immunity, now you're protected. The thing is, the science has shown that, number one, that degree of immune response really varies. People who were severely ill, they mount a bigger immune response. People who had mild illness, they don't have much of an immune response. They don't build as much in the way of antibodies or those other aspects, those memory cells in your immune response. So natural immunity gives you something, but not as much protection as the vaccines. The vaccines are engineered to give you a higher antibody response, give you a more targeted approach to responding to the virus. But there's a new piece here now with the Delta variant. And that is, if you had COVID before, but it was like the original wild type or, the alpha variant, your natural immunity will not protect you against the Delta variant.
Could you repeat that?
Yeah. So if you had, you were infected before with COVID-19, not the Delta variant, one of the other variants. You have some natural immunity. That's good. But it's not natural immunity that will fight off the Delta variant. What we are seeing now is more than 92% of the new cases of infection that we're seeing in South Carolina, they're among people who are not vaccinated. And part of it is, even if they were infected before, that natural immunity will not fight off this Delta variant. That's another reason why it's so important that even if you had COVID before, that you get vaccinated, because all three of those vaccines will protect you against not just the Delta variant, but the other variants as well.
Okay.
Now, in terms of monoclonal antibodies, so what are those? So antibodies are things that you make to help fight off an infection. It is possible, if you get COVID-19, to get a medication called monoclonal antibodies that will help you fight off the infection. These are antibodies that are made in a laboratory. So let's say you're someone who didn't get vaccinated and you get COVID-19. And maybe you're not terribly sick at first. Maybe you have just mild illness. But if you are at risk to going on to getting more severe illness, let's say you have diabetes, or you're older, or you have kidney disease, or even if you're just seriously overweight, that's an increased risk for severe disease. They can give you an infusion, an IV, of this medication called monoclonal antibodies. These are antibodies that were made in a lab, and it's like they'll kickstart your system. They'll give you antibodies right from the very beginning, so you don't have to wait for your body to naturally make the antibodies. It's like giving it to you early on. And the early on part is important. These monoclonal antibodies work best if they're given early in somebody's infection. So let's say somebody tests positive. You don't want to wait until you're seriously ill and have to go in the hospital. Then it's too late for those antibodies to make a big difference. They've got to be given in the beginning. So if you test positive for COVID-19, talk to your doctor, your healthcare provider, or if you don't have a healthcare provider, talk to somebody at the place where you tested positive. Talk to the pharmacist, talk to an urgent care, even go to the emergency room to ask about being given these passive antibodies. These are antibodies that you can get as an IV, or even now they've got a new way of giving them, or they can give it to you as a subcutaneous injection. That's like right under the skin, like the way we give insulin. So, it's not as big a hassle for you. It doesn't take as long. They don't have to start an IV. They can give it to you under the skin. I think a lot of people don't know about monoclonal antibodies as an option. Physicians do, but sometimes people aren't being tested at a doctor's office. They're being tested at a testing drive-through thing, and so they get the results later. That it's important that they know about these, that these things can make a huge difference. We've had more than 11,000 people in South Carolina treated with monoclonal antibodies. And we think that it's estimated that that's probably kept about 1,300 people out of the hospital, and more than 500 people, probably saved more than 500 lives. But I know that there were other people who could have benefited from monoclonal antibodies, but didn't get them. And I can't help but wonder whether they just didn't know about them.
Right. So also there was another question about people who are still getting the still having COVID that had the vaccines. And so they're asking why should we still get them if we're still going to get COVID? But my response, and I want to hear yours, of course, but my response was people are not getting as sick when they have the vaccine as they would if they didn't have the vaccine.
Oh, yeah. No, that's definitely true. Now, of course, nothing in life is 100%. It's true that there are people who are fully vaccinated and still got the virus. But how sick were they? So I mentioned a little bit ago that 92% of the new cases we're seeing in South Carolina are among people who are not fully vaccinated. Also, 100% of the deaths that we saw, we just recently were looking at this in early June, 100% of the deaths were among people who were not vaccinated. So the people who were vaccinated who still got the infection, they got milder infection. The vaccine may not have 100% prevented infection, but it prevented them from needing to be in the hospital. It prevented them from dying from the disease.
Wow.
So, Mark, you got that question? You see that question, Mark?
Yeah. Mm-hmm. Yes, sir. Yeah.
That's why we vaccinate people for influenza. It's not just to prevent the flu. It's also to prevent, if you get the flu anyway, prevent it from being a serious disease, prevent it from killing you.
Right.
Absolutely. Absolutely. So we got a question that it says, is vaccine expected to be available for children under 12 soon?
Well, unfortunately, we do expect vaccine will be available for under 12, but I'm afraid it's not going to be soon because it's complicated. Kids it was not that difficult to extend the studies to age 12 through 15 because kids age 12 through 15, yes, they're physiologically different. Their hormones are different. There are different levels of maturity than kids 16 to 18, but not that different. But if you're talking about kids under 12, 1-year-olds through 11-year-olds, they're very different. They're different in terms of their weight. They're different in terms of their metabolism. So it's going to take a lot more studies for them to sort out what's the best dose. Is the best dose by age? Is the best dose by weight? So it's going to take a longer time. The estimates that I have heard is that we probably won't have a vaccine for under 12 until mid-winter. So we won't have it for this upcoming school semester. The best thing I can recommend for protecting your child under age 12 is vaccinate around them. Get your teenagers vaccinated, talk to friends and family, the people that you get together who are eligible for vaccine. Talk about getting vaccinated to protect the kids under age 12. And also, since we don't have a vaccine for under age 12, I worry about those kids going to school and then coming home if their parents are not vaccinated, their parents, their grandparents, and bringing virus home.
Wow.
Yeah, absolutely. So keeping along the lines of that, so we know that Moderna had applied for EUA status. What's the status on that? Because I know they halted it when the condition around the heart came about. What are the any updates on that?
So I know FDA is reviewing their application for authorization for down to age 12, but I don't have an update on that yet. I think when they review these things, people must wonder what takes them so long. Well, they have to look at all the statistics And they also look at what studies happen, not just in the United States. They look at studies that happened overseas as well. So they want to make sure, and in the United States, they don't just like take the company's word for it. They don't just take their analysis where the company says, oh, it was, X percent people had this complication or X percent of people didn't develop disease. They want to see the original data. It's like they want to see the notebooks from all of those scientists.
Yeah.
They don't do it quite as rigorously in some other countries, but here in the United States, they really, make sure they've got all of those details. I think Moderna will probably be approved for down to age 12. I mean, that vaccine is so similar to the Pfizer vaccine, but we're not there yet. They don't have it approved yet.
So, Dr. Kelly, what you just said really dispelled a whole lot of myths anyway. Because if that's the case, if they're going through all these tests to make sure it's safe for our children, then that means that somebody's doing some tests to make sure it's safe for everybody, right?
Oh yeah.
And so if it was just off the hip thing, then we would just say, yeah, everybody get the vaccine. As soon as you're born, as soon as you come out the mother womb, whenever you get the hepatitis vaccine, you go ahead and get the COVID. So, but you're doing studies, and it's taking a while to get these studies in place. So if that's working, then people need to understand that everything has been tested. Up until when we first started getting them back, was it last year we started getting them? Was it this year?
End of December.
In December, right? So whenever we started getting them in December, then tests had to happen before December, and tests has been going on ever since then. So it's not like we just overnight came up with a vaccine and pulled something out of a water bottle and stuck in people's arms with metal flakes, chips, a whole bunch of HIV. Alien stuff, so that didn't happen. It was a whole intense process, and we had the basis of the vaccine already established many, many years ago. And so just adding this other part to make it effective for what we have going on now is what the issue was.
You just said a bunch of important things. The fact that these studies are ongoing, meaning those people who were in those original studies, a year or more ago, do you know they still are following them? They are still studying them to find out, okay, it's been a year. Have you had any other medical problems? Have you had any other things come up that we need to look into? And I'll tell a different story. And this is a friend of mine who's an older pediatrician. He's a physician. He told me this story that, he got vaccinated way back in the beginning, probably back in January when one of the first people to be vaccinated. And then 5 months later, he had a gallbladder surgery, and it got reported. It got reported in this system. Anybody after they've been vaccinated, if they have surgery or they have a medical complication, it gets reported. And then he said the next day, CDC was on the phone with him, wanting to know all the details. Now, his gallbladder surgery had nothing to do, right, with the vaccine he got 5 months earlier. But my point in telling that story is that every one of these, when a complication is reported, even if it doesn't seem remotely related, CDC looks into it. That's how they found out about these rare cases of myocarditis, these rare cases of the blood clots. They found out because they've got a system in place to look for even rare things. So I understand people are worried about, the unknown. I mean, gosh, some things don't come out. You don't find out about these really rare events until you have 330 million doses of vaccine. But to put that in perspective of, it's like my example of, 100,000 people and, 4 of them might get myocarditis. And that's even the highest risk group of, young men. But compare that to, 100,000 young men who don't get vaccinated, and that a certain number of them, it's not trivial. We're talking, maybe less than 100, but it's not zero, who end up in the hospital, who end up with long COVID, or even end up, severe enough complications that they die. So the safety issues is important, but I feel like we in the United States have the strongest safety review system in the world for medications, and that goes for this vaccine as well. Why do I say that? How can I say that? Well, because I've seen it in action. This guy who had gallbladder surgery 5 months after the vaccine, they're calling him up because they're trying to figure out, is this somehow related? And then they decided, no, it's not related. But they looked into it, just like they looked into, these blood clots. Are these blood clots, blood clots happen, right? Certain number of people get blood clots, and we don't even have a good explanation why. They looked into these blood clots, and they said, okay, this is a rare complication we need to understand more about. We need to understand how to treat it and what the risks are. So when we talk about the unknown, I feel like by now we know a lot about these vaccines. And, we're living in a strange time. We have 3 vaccines that are highly, highly effective. They're like the most effective vaccines that we've ever had. I mean, they're more effective than most of the vaccines that we routinely use. 95, we're talking about 95% effectiveness. And yet we're living at a time where people are afraid, and they're afraid. They don't know what to believe. They're afraid to get vaccinated. They're afraid not to get vaccinated. So trying to get out the information to people that it is a risk right now to not get vaccinated, and you need to look at that risk too. What's your personal risk? Are you out and about? Does your job take you out where you're exposed to other people? Are you exposed to other people at church, at school? What are the settings where it's your risk of being exposed? And then if you are exposed, what's your risk of getting long COVID or your risk of getting serious illness? You got to weigh that against the these rare risks with the vaccine.
Just as a sidebar, automobiles are produced, manufactured every single year, right? A bunch of them, millions of them. And then people never question whether or not they're safe. Even though they hear all these recalls, nobody ever stopped driving, right? They still drive. They still trust the science of automobiles, but they don't trust the science of anatomy, the science of medical physiology. And so that's what really gets me. A car can break down anytime because they're meant to have flaws. But whenever we have a medicine that's proven to be 90% effective, where a car is never 100% never. And, even our flu vaccines are 40 to 60% effective, but we rely on those every single year. So I think we have our priorities really, really mixed up, where other things matter more than our life and our health and the health of those around us. So I think more education around our medical well-being and our health well-being should be more of a conversation than anything else, because this is important. I'm really, really upset that I can't go out and do the things freely that I want to do without wearing a mask and looking like a little mad bulldog with a muzzle on every single day, right? I want to get out of that thing because it's getting hot. And then people can't see my beard. My beard has got wider because of being covered up, So I wanted to get some air as well. So we really need to ramp up our education and really get people into the clinics and into the sites where they can get these vaccines. And please, y'all, just if we get together and do it, we're at 40. I think the last numbers I saw for South Carolina, we was at 49% of people who have at least one vaccine. And totally, we're 43 or 46% of being totally vaccinated. So we're close. We're really, really close. And we just keep pushing. We can get there.
Yeah, no, that's a good point. I do worry about those people who've had only one dose of vaccine. Yeah. Now, if they got the Janssen vaccine, one dose, you're done. You're because that's how they manufactured it. That's how they engineered that vaccine to work after just a single dose. But with Pfizer and Moderna, it is so important that you get the second dose. So there was a study that just recently came out of England. England often has variants circulating before we do. So sometimes we can learn by just looking at their studies. And they did a study with Pfizer vaccine looking specifically around Delta variant. And they found that with just one shot of Pfizer is only about 33% protective against Delta. After 2 shots, then it was 88% effective against the Delta variant. So that second shot, that's really important. And when we talk about kids going back to school, teenagers going back to school, now is the time to get them vaccinated, because it takes 5 weeks before you're fully vaccinated, right? You get your first shot, then you wait 3 weeks, then you get your second shot, but you have to give that second shot time to have its effect. So it takes 5 weeks before you're fully vaccinated from the day you first start. So now is the time to get your teens vaccinated.
Yeah, because it's about time. We're right at the limit, at the cusp right now, where school's about to go back in, and they're already having summer school classes. So they have those people still in school. So we got to work a little bit more diligently to get everybody vaccinated. But Dr. Kelly, I think it was one more question. I think it slipped my mind what I was supposed to ask. I guess it'll come to me before you get off. I hope so.
While you doing that, I do have a question. Someone asked, how different is the Johnson & Johnson vaccine and the flu vaccine? Both have side effects of Guillain-Barré syndrome.
Yeah, so this syndrome, which is it's a French word, it's pronounced Guillain-Barré, or just GBS. So this is a rare syndrome. It's a nervous system syndrome. And this is another thing where it really varies. Some people can get completely paralyzed. It starts with like weakness in the muscles because your nervous system is not right. And it can go all the way to being so you can't move and you have to be on a ventilator. So this is a really frightening syndrome, right? Fortunately, it is rare. And fortunately, for most people, it resolves. It goes away. You're temporarily in the hospital, and fortunately for most people, it goes away. There have been cases of Guillain-Barré syndrome that, again, occur out of the blue, and nobody knows why. Was it because of some other virus that was passing through? Is it part of an autoimmune condition? Like I mentioned, lupus, things where your body makes antibodies to yourself. So sometimes it just comes up out of the blue. Back in 1976, some folks may be old enough to remember the swine flu in 1976. That's when it first came out that the flu shot that year. There were a few cases of Guillain-Barré syndrome that came out after that vaccine. Now, I'm not talking about a lot. I'm still talking about it being a rare complication, but it's a serious complication. Studies have gone on since then, looking year after year at flu vaccines, especially saying, do flu shots cause Guillain-Barré syndrome? And it looks like a certain small percent of people are more susceptible to developing this. And if you had Guillain-Barré in the past with a flu shot, they usually recommend don't get another flu shot, just play it safe. So recently, information has come out about a small number of cases of Guillain-Barré syndrome coming after the Janssen vaccine or Johnson & Johnson vaccine. There haven't been any associated with the Pfizer or Moderna. Now, when I say associated, that means a certain number of people develop this syndrome a certain period of time after getting the vaccine. It's not exactly cause and effect. We don't know for sure that it's causing this Guillain-Barré syndrome. It's sort of like my example of the doctor who had his gallbladder out 5 months after he got his vaccine. Were those two things related? They decided they're not related. But Guillain-Barré syndrome, CDC is looking at that right now. It looks like it may be related to the Janssen or Johnson & Johnson vaccine, but it's a small number. And it's just so hard to make decisions when we're talking about small numbers. You're talking about a 1 in a million risk. Well, I mean, there's a 1 in a million risk of getting a severe allergic reaction to any vaccine. There's a much higher risk of getting allergic reaction to penicillin shot. And yet we still give people penicillin shots and we treat them if they have a severe allergic reaction. It's the same kind of story with Guillain-Barré syndrome. I don't want to minimize it. It can be a serious nervous system problem that is treatable. There have been a certain number of cases associated with the Janssen vaccine. Is it cause and effect? I don't know. They're looking into it. It didn't stop it wouldn't stop me from getting taking that vaccine or, or recommending it to a family member. My husband and my son, they both got the Janssen vaccine. I got the Pfizer vaccine, it just because that was what was available to me at the time. But I would still recommend any of these vaccines. We're talking very rare events.
So real quick, let's talk booster. I've seen in the news Pfizer mentioned having a booster. I didn't see anything about Johnson and Johnson or even Moderna, but it seemed to be around Pfizer and a booster in about 6 months. Could you talk a little bit about that?
Sure. Now, remember, who is it who's talking about Pfizer and a booster in 6 months? Who is saying we're going to need a booster in 6 months?
Pfizer.
The media.
Yeah, the CEO of Pfizer.
Yeah.
And what does he do for a living? He sells vaccines.
Vaccines, yes.
So just take that with a grain of salt. There are
Right.
two things to think about with regards to boosters. Number one, some people do not have very strong immune systems. It may be because they're very old, or it may be because they're on medication that is a suppressant to their immune system. It may be that they're on cancer chemotherapy. You know, there are some, or they had an organ transplant, heart transplant, or kidney transplant, and so they're on medication so that their immune system doesn't work as well. There are studies going on right now to figure out, would giving a third dose of a vaccine, would that help those people? Because they don't have a very strong immune system response. So that's one thing. You know, there are studies going on right now. Are there certain people who have a weakened immune system who would benefit from getting an extra dose of vaccine? And I think that there's some evidence for that there are certain people who would benefit from an extra dose. Now, what about the general population, though? What we know thus far is the general population does not need a booster. Why do I say that? Because what we're seeing, not just in South Carolina, but the nation as a whole, is 99% of the people who get seriously ill or die from COVID-19 are among people who are not vaccinated or not fully vaccinated. Maybe they got one dose of Pfizer. So what that tells me is that the vaccines are keeping people safe from severe disease. Number two, we know that there are studies with all three of these vaccines that are where they go back and they look at people who were vaccinated 8 months ago, for example, and say, okay, are you still making antibodies? What are your T cells doing? You know, those other pieces of your immune system, the memory cells, what are they doing? Are they still recognizing virus? And those studies have shown that yes, 8 months out, we still have good antibody and T cell response. Well, does that mean, oh, the vaccine's only good for 8 months? No. It means the vaccine is good for at least 8 months. Mm-hmm. So will we need a booster 6 months from now? Well, I guess nobody can tell 100%, but it's not looking like we would. Right now, vaccine effectiveness is looking really high and long lasting. Now, there are two more things to think about, though. One is, what if we get a different variant? You know, something else crops up that the vaccines don't work as well against. Well, then maybe we need to create a booster shot that would specifically be for that variant. So that's a possibility, but we're not seeing it yet. It's just that's a possibility. The other is it's smart. It's smart for Pfizer, Moderna, Janssen. It's smart for them to be prepared, for them to look at, let's create, booster shots. Let's do the science. Let's do our homework. So we make a booster shot just in case we need it. So they're not going to manufacture hundreds of millions of doses, but they'll do their science work so that they've got it if they need to ramp up. So right now, this is not just my opinion, CDC, FDA, the other scientists are all saying we do not anticipate needing a booster for most people in 6 months. We might for people whose immune systems are really, weakened. But for the general public, we're not thinking we need a booster. However, it's great. Vaccine producers want to work on that and make sure that they're prepared. Then that's a smart idea. But if you're hearing it from Pfizer, but Moderna and Janssen are also working on, doing that science homework. so that they're prepared just in case.
So I want to make the distinction also from a booster, which is they're talking about, and a preventive shot next year, similar to the flu vaccine. So we know in October, prior to October, we get the flu vaccine in hopes that it carries us to March, right? So I want to make that distinction between what we're talking about, a booster, you get your 2 shots, then in 6 months you get a booster, as opposed to maybe next year saying, okay, as a preventive measure, I need to get my COVID-19 vaccine.
That's a very good point, and I'm glad you brought up influenza. So let's talk about flu shots, and I'm just going to choose one, the tetanus shot, because I think most people know that you need a tetanus booster once every 10 years. So what's going on there? So with tetanus shot, you're protected against getting the disease tetanus if you step on a rusty nail or you have an infected cut, but it doesn't last forever. That vaccine just does not last forever. It lasts a good 10 years, and in 10 years, you get a booster. It's the same tetanus vaccine that you got 10 years ago. It's just you're getting, an extra exposure. So, stimulate your immune system. That's different from what we do with flu shots. Okay. The flu is a little bit different every year. That virus mutates also, and it's a little bit different. Its protein coat on the outside of that virus is a little bit different every year. So we need a little bit different vaccine every year. So that's not exactly a booster. It's not the same thing given, again, it's a little bit different vaccine because it's been tailor-made for the virus that's circulating. So that's what I mean about if we get a different variant that comes right now, the vaccines we have work for all the variants that are circulating. But what if we get a variant that is different enough that the vaccines don't work? Then we might need a different kind of vaccine. And that's what the companies are working on. They're trying to anticipate, do we need to pay attention to these different mutations? Can we tweak the vaccine so that it is possible, just like the flu is different every year, it is possible that we might need a different COVID vaccine every year, but that would be because we got new variants. And nobody can tell. Only time is going to tell. But I don't think we're going to need boosters in 6 months.
And so what about, and this is my last question, what about mixing vaccines? Because we've seen that a lot. We've seen people getting the Pfizer over here, and then so since we can't get back over there, we go over here and get whatever they're giving over here, and mixing those 2 vaccines.
So it's not recommended that you mix. Like if you get the Pfizer as your first dose, it's recommended that you get Pfizer as your second dose, or if it's kind of an emergency situation for some reason you can't get Pfizer, then you should get Moderna as your second dose. But it's not recommended that you mix and match. All these vaccines are a little bit different. You should finish your course with one of them. Like you start with Pfizer, finish with Pfizer, start with Moderna, finish with Moderna. But I know some people are asking, well, okay, I got Janssen, and so I'm fully vaccinated, but is there any value to me going on and getting Pfizer as well? There are studies looking at that right now. So I don't have a scientific answer to that right now. I know that there are studies looking at that. There's no safety risk. I'm not worried that, that would be like an overdose of vaccine. I'm not worried that it's going to make people sick. But we don't know if it really adds anything. If you got your Janssen and you got your antibodies and you got your T cells are all revved up, is there value in getting Pfizer on top of that? Does that add anything? They are studying that now. In fact, I just applied to be enrolled. I told you I got Pfizer vaccine. And so I just enrolled in a vaccine study because I want to help support the science of this so that they will measure my antibodies, my T cells. They'll give me the Janssen vaccine and see if I get any benefit from having that extra dose. So there are those studies, and people could enroll in those studies if they're interested. I don't see any harm to it. I just don't know that there's any benefit to it.
Okay. So it's really not going to. So just say if I went to a clinic in Chesterfield County to get a Moderna, and then I decided I forgot I was supposed to get my shot over there. So I came over here and didn't realize that they was giving Moderna, and I got I got my shots mixed up. That's not going to cause me any health issues at all.
Well, let me qualify that, because there's a timing issue, right? You got to wait at least 3 weeks between Pfizer and Moderna, Pfizer shots, and at least 4 weeks between Moderna shots.
Mm-hmm.
So if you got a shot in one place and you couldn't remember whether it was Pfizer or Moderna, and you show up, number one, they'll have it in your records. They can look that up. Or if you get vaccinated, they give you a card and with the information written on it. And what I did with mine is I took a photo of my card in case I lose my card. I'll at least have that photo on my phone. Or if I didn't have my card with me, I'd probably have my phone with me. So you would want to make sure they were spaced out enough. You wouldn't want to get one shot and then the next week or 2 weeks later get the second shot. They need to be spaced out. And as I said, there is no evidence of harm in getting those additional shots, other than, to be the same thing with those rare possible side effects, but they're rare. But in terms of would we recommend getting that additional shot? Well, we don't have the science to recommend it yet. They're studying it right now. The one other thing, though, to think about is if your insurance company paid for you to get vaccinated, they might not pay for you to get a third dose, right, because they consider you fully vaccinated.
Right.
So you might have to pay out of pocket if you tried to get that extra dose.
Wow.
Or you can sign up for a study, get your extra dose for free, and they'll even pay you for being in a study.
That's right. That's right. That's right. Wow. This is some great information that you were able to provide for us. I'm sure there's more questions. So, as always, we definitely going to have you back as time goes on, and we need more information start coming out, and we need an update. So, you've been a great friend to the show, and we want to thank you for being here and answering any questions and providing that information for us.
Oh, gosh, thank you for the service you provide to your community and getting information out and reassuring people and answering questions and getting them vaccinated.
Absolutely. Absolutely. All right. So we're gonna close out. And as always, if they want information on the Delta variant and the vaccines, where should they go, Doc?
Absolutely. You can email me directly. Honest to goodness, you can, because I know, if you've got a question, lots of other people out there have the same question. So you can go to our website, which is our DHEC website. Let me see what the best. Sorry, I'm just pausing. It may be the best website is to go to SCDHEC.gov/COVID-19. A lot of different information there. CDC also has a lot of information. You can just Google CDC COVID, and that'll take you places. But I am happy to share my email address with you. My email address is Kelly, Kelly, JM, because my middle name is Marie, the number 1 at dhec.sc.gov.
Wow. Thank you so much. Thank you. And just like that, also, you can get information on CareSouth Carolina programs. And earlier, Daniel mentioned the monoclonal antibody. We are one of the organizations that do offer that in as a IV infusion. So I think we've closed in on 350 maybe, or 330, 40 people that we've provided that to. So if you want more information on COVID-19, you can also reach out to us at www.caresouth-carolina.com or contact us at 866-498-0399. And again, thank you, Dr. Kelly, for being with us today. And you have a wonderful weekend, a wonderful trip. You enjoy your kayaking.
Yes.
And being on the water. I'm sure
outdoors is safer than indoors.
Yes,
outdoors.
ma'am. Yes, ma'am. Yes, ma'am. It is. And with that warm weather that we've been having here lately, being on that water is going to feel really, really good.
Yes. Well, thank you again for inviting me. I look forward to talking again with you in the future.
Yes, ma'am.
Absolutely. And Daniel, 2 words for you and your gray beard, midnight cocoa bean. All right. All right. And Doc, if you could stick around after we end, okay?
Okay.